Honourable Senators, I'd like to begin by thanking you all for the opportunity to appear before you today. I am accompanied, of course, by senior officials, which I am confident will be extremely helpful in responding to concerns and questions that you may have. I'd also like to begin by acknowledging the important work of the Senate, and in particularly the work of this committee, in conducting such a comprehensive review of Bill C-45, the Cannabis Act. Your in-depth study has provided opportunities for Canadians to learn about this important and transformative policy initiative, and for our government to explain the objectives and key features of the proposed framework for the legalization and strict regulation of cannabis. I will focus my remarks today on two aspects of the issue at hand. First, I will speak to the various strategies that, along with the legislative framework that will be established under Bill C-45, constitute the key pillars of our public health approach to the legalization and strict regulation of cannabis. Secondly, I will touch on a number of areas that I know have been of particular interest during the Senate study and key points underpinning our government's policy decisions and approaches in these areas. The public health approach that our government is taking to cannabis legalization and regulation is comprehensive and thoughtfully designed to support our objectives of better protecting Canadians and minimizing the harms associated with cannabis use. Our government has learned from the existing evidence and from the experience of jurisdictions in the United States that have legalized and regulated access to cannabis. Our approach has been informed by the input of experts and extensive consultations with Canadians from coast to coast to coast. And as you will have heard on multiple occasions over the course of your study, our approach goes beyond the proposed legislative framework that would be established if Bill C-45 were to become law. In fact, we are taking decisive action in a number of key areas. Our approach is informed by the strict regulatory controls that are currently in place for Canadians who access cannabis for medical purposes, and by the lessons learned from our considerable success in taking a public health approach to reducing tobacco smoking rates. Our strategies include efforts to educate Canadians about the harms and risks of cannabis use, to promote healthy choices and to restrict youth access, to prevent problematic and high-risk patterns of use, to protect Canadians through strict regulation and vigilant oversight, and to monitor cannabis trends and impacts in order to quickly respond to any new threats or risks that may emerge. I would encourage the committee to consider the proposed legislation in the context of these broader, proven strategies for protecting public health. And of course, effecting such a major change cannot happen overnight. And as I have mentioned on very many occasions, the legalization and regulation of cannabis should not be viewed as a single event, but rather as a process that will happen over time. And we are confident that the policy framework that we are proposing, which is informed by the thoughtful expert advice provided by our Task Force on Legalization and Regulation, will put Canada in a far better position and a stronger position to protect the health and safety of Canadians, especially our youth. We are also mindful that this is a complex and transformative policy initiative, and that our policy objectives will not be met merely with the coming into force of Bill C-45 alone. Instead, the success of our initiative will rely on ongoing work in areas which I have identified and our ability to be responsive to new evidence, developments, and trends. Against this backdrop, I would like to speak to a number of specific areas that have been at the forefront of the Senate study to date and the main points underpinning the government's policy decisions and approach in these areas. First of all, with respect to the issue of home and personal cultivation, I know that this has generated considerable debate in the Senate and in the public domain. Our government's view is that allowing adults to cultivate a limited amount of cannabis in their home is consistent with the objective of displacing the illegal market, and it can be done in a responsible way. This is the approach that was recommended by the Task Force on Cannabis Legalization and Regulation, and it is the approach that has been adopted by the majority of jurisdictions in the United States that have regulated access to cannabis. Setting a very low limit on the number of plants is a reasonable way to allow adults to cultivate cannabis for personal use while prohibiting larger-scale grow operations. By being too restrictive in the prohibition of personal cultivation, we risk criminalizing adults who are otherwise law-abiding, which is contrary to the objections of our bill. Another area that has been the object of Senate committee's recommendations is the possibility of establishing cannabis product requirements directly in the legislation, rather than through regulations, as has been proposed by our government. The possibility of specific amendments was suggested on packaging and labeling, as well as THC limits. This was raised at committee. And on this, I would simply stress the importance of maintaining the flexibility within the legislative framework to be able to be responsive and to adapt to new evidence and product innovation in this evolving space. The task force recommended the creation of a flexible legislative and regulatory framework for this very reason. And Bill C-45 provides for this flexibility to adapt to new evidence and product innovation by establishing a range of regulation-making authorities, including on THC limits, packaging, and labeling. I can assure you that our government is intent to establish, through regulation, THC limits for different types of cannabis products. It is also our government's intention to require child-resistant, plain packaging of cannabis products with strict requirements to display clear health warnings and messages and standardized cannabis symbol. All of these measures are intended to protect kids and to reduce the appeal of cannabis products. The next area that I would like to raise is one that relates to a top priority for our government: Indigenous interests and concerns in the context of the proposed framework to legalize and strictly regulate cannabis. I know that this issue has been a prominent theme throughout the Senate review. Engagement with Indigenous leaders, organizations, and communities has been ongoing for over 2 years, beginning with the Task Force on Cannabis Legalization and Regulation and continuing throughout the development of the framework up to this point. This extensive engagement has led to a better understanding of the diverse perspectives among Indigenous leaders and communities. It has also led to concrete action to respond to some of their concerns. Indigenous communities have expressed a strong interest in ensuring that Indigenous people can benefit from the economic opportunity of the emerging legal cannabis industry. Health Canada has responded by establishing a navigator service designed specifically to help guide self-identified Indigenous applicants through each step of the licensing process. Indigenous Services Canada has responded by making its economic development programs available to support projects related to cannabis. Indigenous organizations have called for support to prepare for cannabis legalization and regulation, and for this reason, our government is providing financial support to the Assembly of First Nations Cannabis Task Force and the Thunderbird Partnership Foundation to conduct additional work consultations and engagement. In response to calls for culturally appropriate public education, our government has announced significant additional investments in Budget 2018, and these funds will support the involvement of community-based and Indigenous organizations that are educating their communities on the risks associated with cannabis use. Indigenous communities and leaders have also identified the ongoing need to improve access to health and social services, and goes well beyond the issues associated merely with cannabis use. In Budget 2018, our government has announced new funding to enhance the delivery of culturally appropriate addictions prevention and treatment services in communities with high needs, and for mental health and emotional supports. And by no means, Senators, do I mean to suggest that our work is done. Some of the issues that have surfaced during debates on Bill C-45 point to broader social, economic, and public health issues that will require continuous engagement and sustained efforts over the long term. However, I wish to reinforce that delaying the coming into force of Bill C-45 is not, in my respectful opinion, the proper response to these issues. We have talked extensively about the shortcomings of the current approach, and as I mentioned earlier, the public health approach that we are proposing will better position us as a nation to tackle these issues as they relate to cannabis. Canada has some of the highest rates of youth use of cannabis. The illegal market is thriving for Canadians, including for Indigenous peoples, and they all continue to be subject to criminal prosecution for possession of small amounts of cannabis. Delaying the transition to our proposed new legal framework would in fact perpetuate a system that is failing our children and putting our communities at risk. In conclusion, I want to reinforce that the legislative framework that would be established through Bill C-45 is the result of 2.5 years of extensive work and consultation. It reflects and balances diverse perspectives from provinces and territories, municipalities, Indigenous communities, and First Nation governments, and a wide range of experts and stakeholders. Provincial and territorial governments have developed their own legislation on the basis of this proposed framework, and investments and preparations to establish retail systems in their jurisdictions are well underway. Once again, I wish to express my appreciation for the in-depth review of this proposed legislation conducted by the Senate, and I look forward to the opportunity to discuss any outstanding questions that you may have of us. Thank you, Senator.
Thank you very much. We'll do our usual 5 minutes each. That includes questions and answers. The shorter the questions, the shorter the answers, the more you can get in your 5 minutes. So we'll start with Deputy Chair Chantal Petitclerc.
Thank you, Mr. Chairman. Thank you, all of the witnesses, for being here today. I have a question for you, Mr. Blair. In fact, I would like I would like a confirmation on the robustness of this bill insofar as packaging and advertising and marketing is concerned. Because here, and in other committees as well, we saw that the industries are already very creative and dynamic, and we even saw that they were benefiting before cannabis is even legal, that they're taking advantage of this and creating their own brand. And so I'd like to be certain that in terms of packaging and the names that will be allowed to be put on these products, the marketing, the ads and derivative products, that this bill, I don't want to use the word hermetically sealed, but it's sufficiently robust so that we meet our responsibility of protecting youth, amongst other things.
Saying that it is absolutely not the Government of Canada's intention to allow for the promotion of this drug's use by any Canadian. And we propose to strictly regulate the access that young people will have to this drug by effecting a prohibition for its purchase, possession, and consumption by persons under the age of majority in every province and territory in this country. And we have also introduced very strict requirements and restrictions on issues of, exactly as you have mentioned, on packaging, on branding and labeling, on front of package information so that people will know the potency, purity, and the provenance of what's being consumed, including health warnings for those who may be vulnerable to risks associated to the use of this drug, for example, women of childbearing age, or people suffering from other unrelated illnesses or contraindications of this drug. There will be strict limitations on such things as branding, packaging, no lifestyle advertising or promotion. Frankly, we have tried to learn from our experience, the very positive experience, in reducing tobacco usage among vulnerable populations in Canada by placing greater restrictions on plain packaging and through health warnings and other measures. And so I wish to assure you that it has been front of mind in the development, not only in Bill C-45, but in the regulations that will support it at Health Canada. And to that end, if I may, I would just briefly ask Mr. Costins, who is the director of the Cannabis Secretariat at Health Canada, who has a very expert knowledge in this area, to perhaps comment.
Well, I think your answer is pretty comprehensive. There are a few other features that may be of interest. In addition to the different controls that Mr. Blair has outlined with respect to the use of color, the regulations would prescribe font size, position of certain information on the label, really drawing from all of the lessons that I think are behind your question that we've learned through the tobacco control experience. We've certainly studied very closely how industry will try to outmaneuver governments and to build and craft regulations that look to anticipate and be as sort of agile as possible. The last thing is, it's probably worth mentioning that amongst these different features that would be required in the package and the label, there's also a universal THC warning symbol that would have to be present on all cannabis products. And this is largely it's a symbol that we focus tested with parents, with very young children, with teenagers, to help non-consumers who may be in, say, the home environment recognize and stay away from a product that has THC in it. And that's another lesson we learned from the U.S.
And Senator, if I just may simply add, these regulations have teeth. They are enforceable, and there are consequences for breaking them. And I think that's very important as well. The industry has to know not only that we will have these regulations, but we're prepared to defend them, and that there are consequences for breaking them. And until this regulatory package comes into fore, I think we are seeing people trying to scramble to establish themselves and get out ahead. Once these regulations are available to us, I am very confident we'll be able to curtail that activity and bring it under control.
Thank you. And our other deputy chair, Senator Seidman.
Thank you, Chair, and thank you all for being with us today. Mr. Blair, when you appeared before this committee in March, I asked you why the government had not set any targets for reducing the rates of cannabis use among Canadians. In response, you said that you plan to eliminate use of cannabis among young people. Coincidentally, just a few weeks later, the health minister tabled plans to set targets to reduce the rate of Canadians aged 15 to 24 who use cannabis by December 31st, 2021. So, if you're confident that your bill will eliminate cannabis use among young people, why not announce that target today? Moreover, why haven't you committed to setting reduction targets for people over the age of 24, which is very similar to the non-smoking targets that you've set for everyone? And is this because the bill really isn't about discouraging people from using cannabis?
Senator, if I may be really clear, our number one policy goal in bringing forward this legislation right from the outset, in the establishment of our task force, we asked the task force to look at reducing social and health harms. And we identified the first harm as the high rates of use among our kids. And we know that that has not happened overnight, and with great respect, it will not be eliminated overnight. But right now, they have almost unfettered access to this drug. It's available in every community and frankly in every schoolyard. And the cannabis that they have access to is 100% produced and sold by criminals. And we believe that by displacing that illicit market, by driving those criminals out of those schoolyards, and that we can have a better effect of restricting the access that young people have to it. And also by the regulations we're putting in. We've created a new offense, for example, a criminal offense of selling to kids that has real consequences, a penalty of up to 14 years. Cannabis that will be legally available for sale will be sold under a system of strict regulation and oversight where there's accountability, where none currently exists. And simply just restricting their access through regulation isn't enough. And so we're making significant investments, an investment over the next 5 years of $108.5 million in public education to give young people, their parents, their teachers, their health service providers, and their peers information that they can make more informed decisions, that they will know the risks. And our experience with tobacco, we have not been successful in completely eliminating tobacco use among young people, but we've been hugely successful in reducing it. And we're building upon that experience with cannabis.
Thank you. But if I might just get back to the question for a moment, because the question is about setting targets to reduce the rate of Canadians aged 15 to 24 who use cannabis. So the minister said she would set the target, announce the target, plan the target by December 31st, 2021. What I'm asking you is, why aren't you willing to announce that target today? Yeah, what is the target?
And Senator, in explanation of the position the minister's taken, I think it's a very responsible one. One of the things that we also had said right at the outset was the need for good baseline data. And so we have gone to Statistics Canada. We've gone to Ontario Drug Usage Studies and other institutions that are conducting surveys so that we have a very good understanding of what the rate of usage among our young people, what it is they're using in the circumstances and context of its use and where they're acquiring it. We're building up that. We've also putting in place very strong systems, ongoing surveillance and measurement. We've been working with the academic community, with public health officials, Stats Canada and others to establish an ongoing system of measurement so that we can know where we begin and we can see trends emerging, and we'll have a better understanding as we get these things in place as to what's working and is not. I will also tell you that we are quite prepared, as I've indicated in my earlier remarks. This is a process, not an event, and so we are committed to a process of continuous adaptation and improvement to achieve our public purpose goals. Our first goal is the protection of our kids and getting this drug, which has real risks, both health and social for our children, out of their hands. And right now we have the highest rates of any country in the world. Reducing that can have a very positive outcome for the health and the safety and the futures of our kids. And we're putting all of the things in place in establishing strong baseline measurements to begin with. So we'll be able to know exactly what's working and what's not. And we'll continue to measure, continue to evaluate, continue to adapt and to innovate to achieve those purposes. And when we have more evidence and a better experience with its implementation, the minister has committed to coming out with clear identified targets of reduction, which we believe will be based on evidence and not on mere speculation.
Thank you very much. Next, we have Senator Platt.
Thank you, Chair, and thank you, Mr. Blair, and the rest of the witnesses for being here. I will make my comments with the highest respect that I do indeed have for you, Mr. Blair, especially in your previous occupation as one of the country's top police officers, and I just find it mind-boggling when your government can say that one of your biggest priorities is to protect the health and safety of Canadians, especially youth. I think that is pretty much quoting what you said in part of your opening comments. We are legalizing both a drug, that smoking, that we have for years and years been trying to eliminate in other forms because we recognize the horrible health hazards that smoking has. And now we're legalizing a mind-numbing method of smoking. And all the while we're saying we are trying to protect the health and safety of Canadians. That is such a horrible contradiction of statements, in my opinion. Now that, however, isn't my question, Mr. Blair, and I have two questions, and I'll try to get them in under my 5 minutes. You recently stated, Mr. Blair, that Canadians should be truthful in answering questions at the border about marijuana use. However, witnesses before our National Security and Defense Committee told us that any admission of past marijuana use can lead to an individual from being banned for life from entering the United States. Last month, the Department of Global Affairs tabled the following planned messaging for Canadians after C-45 becomes law, and I quote, "You may be denied entry to a foreign country if you have previously used cannabis products, whether for medical purposes or not, even if you have used them legally in Canada." How, Mr. Blair, are Canadians supposed to prepare for being banned for life from the United States for admitting to something that your government is making legal in Canada? That's, if you answer that fairly briefly, I think the chair will let me get my second question in.
Yeah, truthfully, sir, and you made allusion to what I used to do for a living. I would never tell anybody to lie to a law enforcement official at the border or anywhere else. And so I believe telling the truth is upholding Canadian values and the rule of law, full stop. I will also tell you, sir, that we know from their admissions, you know, there are nearly 500,000 Canadians that currently have a record for simple possession of cannabis. We also know that there are several million Canadians who just simply were not caught. And we often hear, you know, admissions from people who have very responsible positions that at one time they use cannabis illegally in this country. And so when they go to the border, there is no expectation. Frankly, I've crossed the border myself hundreds of times. I've never been asked about illegal drug use. But if asked, I would answer honestly. I've never used any illegal drug ever. But I would anticipate, quite frankly, that, and we're working very carefully with law enforcement officials in the United States and in other countries to ensure that Canadians entering into those countries will be treated properly. And we recognize there are currently 30 United States where cannabis is available for use either medically, a dozen or 10 states where it's available for non-medical uses. And frankly, 2 of those are border states, 2 of them border Canada, and it has not been an impediment for Americans traveling into Canada. I do not anticipate it will be a significant issue for Canadians moving into going back and forth into the United States, and we're working with U.S. law enforcement officials to minimize any challenges that Canadians may face at the border.
Hope you give us your phone number that we can call you from the border. I have smoked marijuana when I was 18 years old, 50 years ago, and I may be asked that question. And I hope I'm not, because along with you, I don't believe in lying to somebody that asks me a question. We will be asked more often when this becomes law than we are being asked right now, I assure you. My second question, Mr. Blair, is that your government says you are ready to legalize cannabis. And I note from the bill that it has already been amended at least 20 times in the other place. And we are hearing that we are going to have some 29 more amendments coming to us, albeit technical amendments later today. I'm wondering how ready we are and how many more amendments we will be getting, and how in fact you can sit there and say we are ready and your government is ready when we have at least 49 amendments that are being proposed or have been proposed by your government and are probably going to be proposed by the sponsor of the bill later on today.
Yes, sir. And actually, it actually brings me back to your earlier comments about what you perceive, sir, Senator, respectfully as a contradiction. The current criminal prohibition is largely ignored, as you did when you were 18, but largely ignored by Canadians. And ignoring the existing Canadian law, the prohibition against the possession and purchase and use of cannabis, has created a set of circumstances, first of all, where our kids are in enormous jeopardy, in my opinion, and also where organized crime is enriched to the tune of several $billion each year. They control 100% of the illicit market. They profit enormously from it. One of the things I know from my experience in my previous occupation is you cannot regulate a prohibited substance. And it's only by lifting the prohibition. That's what legalization is. Lifting the criminal prohibition that allows us to introduce a comprehensive system of strict regulation to control every aspect of its production. And we learned in 2013 and in the subsequent 5 years of our experience with licensed production for medical purposes that it can be done right under a strict regulatory regime. Production can be done in such a way that we know the potency, provenance, and purity of what is being consumed for medical purposes in this country. We know that it can be done in such a way where dangerous chemicals are not included and it's not adulterated. And so we're building upon that experience. And it gives me confidence that 5 years of experience with those regulations and licensed production, the production for non-medical use can be done right. We've got the experience, we've got the evidence to support it. We also have been working very closely for the past 2 years with provinces and territories across the country in establishing strict regulatory regimes for its distribution. And we're building on their experience with other substances like tobacco and like alcohol. And so we've brought forward what we believe is a very appropriate, strict regulatory framework that'll do a much better job protecting our kids and displacing that illicit market. And finally, sir, as I've said, we see this very much as a process of continuous adaptation. The Bill C-45 provides us with the opportunity and a framework to move forward, and we are committed to moving forward, but also when technical amendments come forward that make sense, to adapt to make sure that our responsibility is to give Canadians the best laws and the best regulations to protect them.
Senator Stuart
49
Olson.
amendments.
Senator Stuart Olson.
Thank you, Chair, and once again, thank you all. Mr. Blair, I'm kind of on the fence about the legislation, but I'm not reassured by your presentation, and in two instances, and perhaps you can help me with that. The first part is when you said the bill is very comprehensive, very thoughtfully designed, but you're requiring now many technical amendments to correct what are flaws in the drafting, and I don't see that is thoughtful or well designed. The other, my second question is, do you really think that an ongoing or a work in progress is applicable in this area of extreme social change for the country? And I'm not sure that I'm satisfied with that answer, or with your statement that says we're going to monitor, I would have thought if you were going to do this, you would have monitored, you would have done your studies, you would have done all of this groundwork before bringing in the legislation. And if I could just say too that the main reason in much of your statement to us, your main argument has been the criminals making all this money that we can't tax. I hear this over and over, and I'm really, you didn't say we can't tax, I just thought it as you keep saying that. But then when you talk about the Aboriginal peoples and their real hesitation as to the coming into force of this legislation, and you talk about, yes, we've made adjustments, and we're going to have it so they can make money too. So is it the focus of your government to say no pipelines, no this, no that, but by God you can make pot?
With great respect, first of all, in a number of other jurisdictions, particularly in the United States, they had ballot initiatives that said they were going to legalize it and tax it, and it really was about revenue. And with great respect, I would not agree with your statement. Our approach has been entirely predicated on a public health model. We began by looking at harm. We began by looking at harms, both health and social. And the entire approach, and what we asked the task force to go and examine, and what they examined across the country, they had people with expertise from the areas of public health, public safety, justice, and problematic substance use. And they traveled across the country looking at how do we reduce the social and health harms of cannabis use. And that has been the basis upon which this legislation comes forward. One of the things that we have said right from the outset, the revenue, because there are revenue implications through excise tax and sales tax, the Prime Minister has been very clear. The revenue generated for the federal government in their portion of the excise tax as a result of the new Cannabis Act will be reinvested in research, treatment, prevention and rehabilitation. And I might just suggest to you, those are precisely the things that address those social and health harms of which I've earlier spoken. And when we talk about Indigenous communities participating in this new industry, it's because Indigenous communities, First Nations, told us that they wanted to participate. Not all of them, but many of them came to us and said they want access to the economic opportunity that this may present for their communities. And they asked for help. And we responded to that help. And we said, we will provide you with support and assistance. And we hired someone to help them because they asked for it. And that's part of it, the ongoing engagement that we have with Indigenous communities. You know, we've been working on many of the issues and concerns of jurisdiction, on access and participation in this new industry, and on culturally appropriate training materials. We've been working with Indigenous communities, but we're not done. It's an ongoing process of engagement. And that's part of our commitment. It's not just simply that we went and talked to them, we've ticked the box and we're done. What we've said is, we're working with you. We're going to continue to work with you. And as opportunities come forward or as concerns are raised, we'll be there with you to make sure that we, together, through a very respectful nation-to-nation discussion, can address the legitimate concerns of those communities.
Senator Poirier.
Thank you, Chair. Thank you all for being here to answer our questions again today. Mr. Blair, since the bill was introduced and throughout the committee hearings, we heard from some people how cannabis is far less dangerous than alcohol. But that notion is really not reflected in Bill C-45. For example, penalties are way harsher having 6 grams of cannabis in a bag than 6 bottles of beer. So if cannabis is so much safer than alcohol, why are the punishment for youth so much harsher with cannabis?
Well, Senator, first of all, I have never said that cannabis is safe, particularly for young people.
No, I didn't say that you said it was. I said that throughout the committee meetings, we heard from some people that had stated that. I just wanted your opinion on it.
Senator, we're transitioning from a century-long system of criminal prohibition that the overwhelming majority of Canadians have begun to ignore, but it had enormous consequences for individuals who were caught in possession as a result of some youthful indiscretion. Many were not caught, but some were, and they ended up with a criminal record that affects the rest of their life. Their ability to cross a border, their ability to get a job, or you know, just they're classified as having a criminal record. Those consequences are quite significant. We're moving away from that criminal prohibition, but the regulations that we're putting in place, I think reflect Canadians' concerns that have been expressed to us about the availability of this drug, and they want to ensure that we do not allow the illicit market to continue. And many of the penalties that we've kept in place, I think it's important to be very clear. We are creating a system of strictly regulated production and distribution of cannabis, and any cannabis outside of that strict regulatory framework, so illegal production remains a serious criminal offense. Illegal distribution, drug trafficking, remains serious criminal offenses. Import exportation, not under ministerial license, but by criminals, remain serious criminal offenses. And that is simply an acknowledgement that organized crime has 100% control of this market. And the police are retaining all of the authorities, all of the offenses, and all of the penalties that they have had for a century, but we are adding a new element of competing with organized crime by giving them a competitor in the marketplace so that adult Canadians can make a different choice, can make a legitimate, healthier, lower risk choice than the one they currently have dealing with criminals.
Can you tell me when Health Canada is expected to issue a request for proposal for tracking recreational products between the licensed producers and the retailers?
And I'll refer to Health Canada's director for those matters.
So thanks for the question. So we're prepared to launch the system at a point in time when the legislation would come into force, should Parliament approve it. It is a system that we are designing internally. It is not a system that we are seeking to procure externally at this time.
Do I have any time left, Chair? Yes. Okay. Okay, on the question of the home cultivation, our committee has heard the concerns from key witnesses from all fields, and that includes the health, the police, the municipalities, lawyers, and the list goes on. Weighing the pros and cons of this provision is clear. The negative effects and the concerns clearly outweigh the benefit. The most striking comment came from Professor Benedict Fisher, who was a senior scientist with the Institute of Mental Health Policy Research at the Centre for Addiction and Mental Health, and I quote, he says, "In my opinion, it is categorically misguided as part of the supply scheme for cannabis in a public health and strictly regulated approach. It's a recipe for people producing cannabis that is unregulated to expose minors and other vulnerable people who shouldn't be exposed to cannabis, and a recipe for diversion. It doesn't belong in a public health-oriented supply framework for cannabis. The provision should be scrapped." So my question to you is, your government has been clear from the get-go that the intent of the bill was to protect kids from using cannabis, which you say are some among the highest in the world. So could you please explain how normalizing cannabis by allowing unregulated, unchecked cannabis plants in the Canadian homes part of a strategy to protect the people from using, young people from using cannabis?
And let me also be very clear, personal cultivation is not part of the supply framework. The supply framework is the only cannabis that will be available in that supply framework is that which has been produced under strict regulatory license and oversight by Health Canada and available through the distribution systems established by the provinces and territories. But not for distribution, not the supply network, but for individuals. What we have heard in our task force and what we have in our regulations is a limit on how much an individual can cultivate for their own personal consumption. They can't sell it, they can't give it to the neighbors, they certainly can't give it to their children. There are regulations that prevent that. Those would constitute, if they went to the end of the driveway and started to sell it, that's a criminal offense, that's trafficking. And that's illegal production in any amount, 4 plants or 400 plants. And so it's not part of the supply chain. It allows an individual Canadian for their own personal use to cultivate up to 4 plants. It creates an offense for more plants. And I think I think it's very important to be clear. We have, with provinces and territories, said that they can put in regulatory control to ensure that that personal cultivation can take place in such a way as to address local concerns with respect to safety, sanitation, access to children. Municipalities can zone it where it can take place. The provinces can put in regulation that would, for example, limit or restrict or prevent it from taking place in multi-residential dwellings or on school campuses, in close proximity to schools and community centers where kids are. They can even put in a permitting system. A municipality could put in a permitting system so that if some individual wanted to engage in personal cultivation, they had to get a municipal permit to do so and abide by whatever conditions were put in place. And so this is an activity not part of the supply chain, but rather only for personal use, which is subject to strict local regulatory conditions and controls.
Senator Munson.
Well, thank you, Chair. For Senator Plett, marijuana wasn't around when I was 18, but it certainly was around in my 20s. Just a breath of fresh air and chill out the room a little bit, as my sons would say. I support this bill. And I support it for many of the reasons you talk about. So you can take a deep breath, Parliamentary Secretary. I don't know how important that is in the scheme of things, but we are going to have a number of recommendations, many, and amendments dealing with this bill. And being of a certain age, I have covered constitutional conferences in the 70s here at the old train station and seen the bidding to and fro of what makes up this country and what makes up fairness in terms of provincial jurisdiction and powers. And it was a very, very difficult thing to cover over a number of years in those days. With that in mind, and dealing with what we've been talking about in amendment-wise, provinces have made it very clear, and you've discussed this before, but I think we need an update to refresh our memories on the cultivation and possession and harvesting of cannabis plants, including the power to prohibit it. So are there any barriers today, jurisdictional or otherwise, to implementing the recommendation that the provinces want to have that power, or say they have that power to do that, particularly Quebec and Manitoba?
Senator, if I may, I'm assuming you're speaking specifically about personal cultivation.
Yes.
If I also may just quickly address, one of the things that is also in place, which is I think very appropriate to your question as well, is we've established at a minimum the age of 18 for the applicability of this legislation. But we've said to the provinces they may establish their own age, and they have. They've all established their own, which happens to align with their age of majority, 19 in the vast majority of cases, 18 in 2 others. And we have asked each of them, and they have done this in their own legislation, to bring forward regulation that prohibits the purchase, possession, and consumption of cannabis for any individual, any young person between the ages of 12 and the age of majority in their jurisdiction. It prohibits their purchase, possession, and consumption of cannabis. I think the power of that is it doesn't criminalize that behavior. It regulates it. It gives the police the ability to enforce a total prohibition on kids possessing this drug without criminalizing.
Well, just to be clear, though, will these provinces be able to prohibit the cultivation of 4 plants or whatever in their jurisdictions, yes or no?
And with great respect, sir, frankly, I'm not sure I'm able to give you a definitive yes or no. What I can tell you is in the federal legislation, more than 4 plants is an offense under these regulations. And we've been very clear with the provinces, and I will tell you, for example, in New Brunswick, they've brought in regulations that have said that it has to be done in under certain circumstances with locks and security measures. There are other jurisdictions that have said it can only take place indoors and under glass rather than out in outdoor cultivation. Many of the provinces are bringing in regulations which they deem to be appropriate in their circumstances to control personal cultivation, where it can take place, when it can take place, by whom, and under what circumstances. And so I believe, Senator, that they have that authority. What limits and restrictions that may subsequently determine to be had, I think that will be determined by other processes. But we've been working very closely with the provinces and territories to enable them to regulate this behavior in a way which they deem to be appropriate in their circumstance and jurisdiction.
So very briefly, thank you for that. Very briefly, we've been seen to be operating on a timetable. It's like getting out of school at the end of June to get things done before summer happens. And we will have many amendments. You talked about technical amendments, but there'll be substantive amendments, and certainly there'll be a debate around this table. Is your timetable still, 90 days after Royal Assent, and is that Royal Assent, do you hope to happen by July 1st still, and do you see regulation being done and law taking place by September? Is that still your timetable?
Sir, I very much respect the processes that are taking place here, and when you're done, and we move towards Royal Assent, we have already said very publicly that following Royal Assent, we have provincial and territorial partners in this endeavor. And we want to work, and we've been working with them for many months in preparing for an orderly implementation of the new act and regulations and their regulations. And so what they have told us is that they need between 8 to 12 weeks following royal assent to effect a responsible implementation. And so we're working on that timetable whenever the Senate completes its important work. And then the bill moves to royal assent, and frankly, I don't control that timetable. But when that is completed, we have work to do. And we're ready to do that work. Health Canada and is ready to go. The provinces and territories have told us they're ready to go, but they need that period of 8 to 12 weeks to effect an orderly implementation. And so when you're done, sir, we'll be able to give you a far more accurate idea of when the law could come into effect.
Thank you.
Senator Bernard.
Thank you. Thank you for being here. We've heard from a number of witnesses, including the Criminal Lawyers Association, that have highlighted the fact that pardons for past convictions for simple possession of cannabis are not addressed in this bill. And so my question is, does the government intend to put in place a separate system for pardons for convictions of simple possession? And if so, what is the timeline that is being proposed?
Thank you, Senator. The issue of Canadians with a criminal record for simple possession of cannabis was identified as one of the social harms that we hoped to address in this legislation. And by lifting that criminal prohibition and replacing it with regulation, working with the provinces and territories, we have, I think, created a situation going forward where we have significantly reduced the risk of Canadians being criminalized for any activity regarding cannabis. In addition, the Prime Minister has made it clear, while the prohibition remains in effect, while the criminal law is still the only means of controlling cannabis in this country, that law remains in effect until repealed and replaced. And so what you have suggested, frankly, cannot be addressed without nullifying the existing law. You know, there's an appropriate process for repealing and replacing laws in this country, and we're in the midst of it. And so we'll continue with that important work. But the Prime Minister has indicated that once that is done, once we have repealed the criminal prohibition, once we have established and put in place the new regulatory framework for the strict control of the production, distribution, and consumption of cannabis, then the issue of the social harm of those outstanding criminal records is something that he is prepared to address. And so I think that's the appropriate time. And frankly, it is not within the scope of this legislation, with great respect. It is something, if the government chooses in the future to address, would be more appropriately dealt with, not in the Cannabis Act, but in a more particular piece of legislation.
Thank you.
Thank you.
Oh, yes, you've got
Yes,
time.
I have time for another one. So the Standing Senate Committee on Aboriginal Peoples noted in their recommendations that there be culturally specific public education materials on the subject of cannabis for First Nations and Inuit communities. I believe that the education to all Canadians I fully support that recommendation, but believe that public education needs to be gender specific. I'm wondering if a GBA plus analysis is being used in the preparation of public education, but also culturally specific for other cultures, in addition to the First Nations and Inuit. Is that part of the plan?
Yes, ma'am. May I say that I also agree completely with that recommendation from the Aboriginal Affairs Committee, that about the importance of culturally appropriate, and by the way, in many cases, language specific. Language is equally a serious concern, as well as the cultural competence and appropriateness of what's available. I can assure you that in everything that comes from Health Canada, there's a GBA plus lens attached, and so for all of those training programs that will be developed, that I think gender and all of the complex issues that are engaged in that analysis are under consideration and will be included. And I would also agree with you, Senator, we live in a remarkably diverse country. And we have seen the impact of cannabis disproportionately affecting some communities. And I think that demands of us that in the development of the educational and information that we're making available, it's not just simply trying to educate, but making sure people understand the law and how it's to be applied. I think it has to be done in all of the diversity of this country, and particular with great sensitivity to those communities that have been most significantly impacted by the existing system of cannabis control. And we want to make sure that as we roll out these new regulations, we address what I think we both agree are the significant social harms that are possible if it's not done right. Thank you.
Thank you. Senator Patterson.
Thank you, Mr. Chair, and welcome, witnesses. Your government has supported the UN Declaration of the Rights on Indigenous People, which features prior, I emphasize prior, informed consent. You say the task force consulted with Aboriginal peoples, but as you know, the president of ITK has said that consultation and conversation with ITK is not consultation with Inuit. I thank you for coming up to Nunavut, but it was not till about a year after the bill was introduced in Parliament. I don't think anyone would say consultation after the fact, after the bill was drafted, was adequate. We had the AFN National Chiefs in December 17th advocating delay, the NTI Nunavut-Tungavik Annual General Meeting advocating delay. Now, you've said delay coming into force of the bill is not acceptable, but you tell us that concrete action has been taken on the issues that have been raised: economic opportunities, financial support for consultation, fundings for community-based treatment, funding for culturally appropriate treatment programs. You've given us a real quick assurance that that's happening. In light of the nonpartisan Aboriginal Committee's clear concern that a consultation was ineffective, would you agree that the government should come back to Parliament with a more detailed report on these issues of concern? And I didn't even mention the First Nations Tax Commission, saying we've been left out of the revenue stream, and out of respect to the inherent right to self-government, we have to deal with the health, education, and social impacts of this legislation, yet we've been left out of the revenue stream. Would you agree that you should come back to Parliament with more detailed reports on these major issues of concern to Aboriginal peoples before the bill comes into force?
Senator, no, with great respect, but I would like very much to speak to some of the issues that you raised. There was consultation. The task force, when the task force was established, they conducted a number of consultations with Indigenous and First Nations organizations. Actually held a specific event in which, a roundtable in which First Nations and Indigenous organizations were invited to participate. We also received a number of written submissions from them as well. So they were involved in the consultation from the outset. And since that time, there has been, and I may not have the exact number, but I believe about 50 different events where we've come together, we've been involved in a discussion. I participated in many of those, but not all of them. Senior officials, particularly from the Health Ministry, have been involved in those discussions, as well as Indigenous Services and others. I can tell you, I think there's a couple of things. You made reference specifically to the taxation issue. And I had the privilege of attending at the AFN National Assembly, or the Special Assembly, that was held just a few short weeks ago. I actually spoke at that event and then stayed for plenary sessions. I was actually that actually was 3 or 4 hours. But far more importantly, the Prime Minister spoke. And the Prime Minister talked about, with the AFN and with First Nations represented in that Special Assembly, a process of establishing a new fiscal arrangement. And it would include all of the fiscal and financial relationships between nations, between the Government of Canada and the First Nations. I think it's far more appropriate for discussion around things like cannabis excise or cannabis sales tax to be included within the context of that larger fiscal arrangement discussion that the Prime Minister spoke of on that date before the Special Assembly. I can also tell you with respect to issues around public education, we have worked with many First Nations, Indigenous organizations, including the ones you referenced in Nunavut. They were very, I think, compelling in their advocacy for the need for culturally appropriate. We've listened, and what we've done is we've made a commitment to all of those organizations. We're not saying that this consultation process and engagement is concluded. We're not suggesting for a moment that, we visited you, we're done. And I think there's a very legitimate concern among those organizations that this process of engagement continue, that they continue to work with us and to ensure that those educational products are produced and available within their community, that we continue to work with them in not just up until the passage of this bill and the date the law comes into effect, but beyond that date and well into the future, to make sure that for those who wish to be involved in the economic opportunities of participating in this new emerging industry, that they have those opportunities. And so they don't have to get rushed through the door before the law comes into effect. We're going to be with them now and well into the future and continue to working with them. And it's the same thing with the discussion over the exercise of jurisdiction, which is, we very much respect and acknowledge the jurisdictions of First Nations. And we are committed to working with them so that they may exercise that jurisdiction and authority in an appropriate way, and we'll continue to commit to engage and work with them going forward.
Real quick.
Thank you. Oh,
Real quick one. That was a long answer,
sorry.
Mr. Chair. It's
Yes,
not
I
your-
know. I said I've given everybody the 5 minutes. Questions and answers need to be short. I can put you down for the second round. Senator Dean.
For being here today. I've been struck over the last several months by the effort of some to create the impression that when and if this bill is proclaimed and implemented, that we will suddenly have a problem with cannabis on our hands. All of us in the room know that that isn't the case, that this is a piece of legislation that is responsive to a problem that we have with cannabis today. So it's a simple question for you, Mr. Blair. What are the consequences of not legalizing and strictly regulating cannabis in Canada?
I think, Senator, the evidence is overwhelming that the current system of cannabis control in this country is failing. It's failing us on many fronts. Most importantly, it's failing us for our children. And I think the evidence is overwhelming and compelling and conclusive. That, we have among the highest rates in the world of cannabis use for our kids. And it's not just the health risks of that cannabis that our kids are using. First of all, the cannabis itself is untested, unregulated, unsafe, contain chemicals unfit for human consumption. We know that the earlier that they begin to use, the more frequently they use, and the higher potency of what they use, the greater the risks for their health and for their outcomes. We also know that they're buying it from criminals. And so it's exposing our children to a criminal element that young people should never be exposed to. Because they're operating outside the law, in their own mind, they're defining themselves as outside the law. And that's also not good socialization for our kids. We also know that 100% of the market, its production and its distribution, is a criminal enterprise. They don't follow any law. They don't obey any rule. They're not accountable in any way. There's no oversight. There's no governance. There's no testing. They operate in the dark. And they make money. The easiest money they ever made. I ran large organized crime, drug crime units in Toronto for many years. The money they make in cannabis is the easiest money organized crime makes. There's no competition for them in the marketplace. Canadian society generally does not see this as a serious criminal activity, and they control 100% of it. There's no competition. And so it works out to about $20 million a day flowing into criminal enterprise in this country. And so the price of leaving that we're leaving the health and safety of our children in the hands of criminals. We're allowing criminals to make enormous profit. And the sad reality is you cannot regulate a prohibited substance. As long as that criminal prohibition remains in place, there is no way that we can ever get control over its production, control over its distribution, or affect reasonable regulations that control its consumption. And so cannabis is a serious problem in the workplace today. But it's very difficult for an employer to regulate that behavior because it's criminally prohibited. It's a difficult conversation for parents, teachers, and health professionals to have with their kids about the risks of cannabis today. Because how do you talk to your kids about committing a criminal act in a socially responsible or less risky way? And so it's only by lifting that prohibition that we actually can get control of this situation. I think it's a very responsible approach. And for those who focus on the government of Canada is merely legalizing cannabis, they're completely missing the story here. Because the story is we're lifting that prohibition to effect a comprehensive and effective system of regulatory control over production, distribution of cannabis and consumption of cannabis in this country that's going to create safer communities and healthier communities. And it will, over time, displace that illicit market and give Canadian adults a healthier, lower risk, more socially responsible choice. I'm confident they'll make that choice once we make it available to them.
Thank you. Do I have?
Oh, quick, just a very quick.
It will, and it's not a question. As sponsor, as we come to the end of these hearings, I want to recognise the work of the officials who've supported us from various government departments, some of whose work goes back to the task force, and some, as in the case of Mr. Costin, goes back right to the beginning of the medical cannabis system, which reminds us that this isn't a cold start. I've worked with a lot of public servants over the last 20 years. And I can tell you that Canada's public servants have a global reputation for being the smartest and best. And I also include our political public servants in that light. I have seen, we have seen, I have been reminded of the talent and commitment of our public servants by the people who've supported us in this room, and will do that beyond today. And just as sponsor, I want to put that on the record. So thank you very, very much.
Thank you. Senator Ahmedvar.
December of last year, we used to be blessed with the presence of Senator Nancy Ruth in the Senate. She was a member of the Conservative caucus. She was also a very powerful voice for gender equality, and I'm going to try and channel the question she would have asked you. Was a gender-based analysis done on the impact and offences contained in the bill? And if yes, what shifted? And I certainly hope the answer is yes. What shifted then as a result in the bill? And if no, why not?
Senator, the health minister has made it clear, I work very closely with her, that everything within her ministry is subject to a GBA plus analysis. And if I may, I'm going to defer to senior officials who would have been involved in that process from the outset. Gender plus analysis?
Yeah, okay. Well, this may be something where we both have to play off one another. So, as Mr. Blair indicated in the previous answer as well, whether it's launching a major new grants and contribution program, such as the one that he made reference to previously with respect to supporting various communities to do public education and health promotion, disease prevention activities, or whether launching a major government policy, or in this case, a significant new piece of legislation, we undertake a comprehensive gender-based analysis of the impacts of whether it be the program, the policy, and in this case, a change of law. I unfortunately, I do not have before me the GBA that we've concluded. So I feel a bit constrained in trying to recall precisely what the details of that analysis was. Suffice to say that it is a key feature that we undertake and undertook in this regard. I don't know, Carol, if there's anything you'd like to add to that? Okay.
Actually, then if I may, Senator, I'm going to jump back in because I was involved in some of this discussion. And for example, when we were looking at youth usage, we were able to break it down by gender. And we saw that youth usage was higher among young males than it was among young girls, but it was increasing for young girls. And that was, you know, part of the consideration and the concern with respect to training materials. Also in the development of those training materials, our government has been working with a number of NGOs and developing some things, and we're working with a number of different community organizations. And I will tell you that in every conversation I've had with those organizations, I remind them of the importance of applying the lens of young women and girls to training materials, to public responses, to support programs that can be brought forward as a result of this, to make sure that that lens is applied. It is a problem that, quite frankly, is cannabis use that is affecting boys and girls in our society. But we also recognize that the information that we want to make sure that we share with young girls may be a little nuanced and different than that which is used to reach young boys.
Thank you.
Okay, thank you.